Medical practice today demands instrumentation that is fast, accurate, and capable of producing a wide range of clinical data. Experience proves that the best way, if not the only way, for the modern clinical laboratory to cope with this varied workload is through routine, total biochemical profiling. It is not only more economical to subject every biological sample to a battery of tests rather than the 2 or 3 most urgently indicated, but this unsolicited laboratory information yields a bonus of incalculable benefit to doctor, patient, and community. The SMA 1260 system has revolutionized laboratory practice by demonstrating the value of obtaining such information through biochemical profiling. In a large number of cases, profiling makes possible an early detection of unsuspected pathology which effects changes in diagnosis. It is in this light that the advantages of continuous flow analysis and accurate recording of results at steady state levels embodied in all Technikon autoanalyzer systems must be viewed. Brought to its most refined form in the SMA systems, continuous flow analysis has proven itself through more than 15 years of superior laboratory performance all over the world. The SMA 1260 is now the system of choice for daily clinical workloads, routine chemistry profiling of all hospital admissions, and health evaluation programs. Daily clinical workloads become routine procedures with the SMA 1260. 90% or more of the total clinical chemistry workload can be performed on one SMA 1260. As a result, 90% of the samples received are immediately fed into the system without time-consuming, error-prone sample sorting. There is no need for multiple venipunctures. Results are immediately available without transcribing or collating. All lab specimens are handled in the same way, effecting important economies in time and labor while improving the overall quality of the results. Routine admission profiles make complete information available to the physician when he first sees the patient in the hospital, in addition to serving as confirming or negating evidence of the suspected disease. The serum chemistry graph serves as a baseline against which to measure future metabolic changes. Moreover, it has been the experience at various institutions that the patient at the time of admission is usually in a superior state for meaningful biochemical profiling than he is after being hospitalized and subjected to various drugs. For the most complete profile, the ideal system is now the SMA 1860, which interfaces an SMA 1260 system with an SMA 660 system. Operating at the rate of 60 samples per hour from a common sampler, the SMA 1860 provides broad-spectrum profiling economically by further decreasing the handling and sorting of samples and standardizing the laboratory procedure to its maximum efficiency. Further details on this system are given later. Multiphasic health evaluation can only be performed effectively by instrumentation capable of handling large numbers of samples for a variety of significant parameters. The ability to choose the procedures to be performed by the SMA 1260 makes it invaluable to members of the medical community responsible for the wide range of evaluatory programs currently underway. To meet your requirements, the SMA 1260 is custom designed to provide any 12 plus blank channels where applicable of the following biochemical procedures: SGOT, SGPT, alkaline phosphatase, LDH, fractionated LDH, total bilirubin, direct bilirubin, uric acid, urea nitrogen, sodium, potassium, chloride, carbon dioxide, calcium, inorganic phosphate, total protein, albumin, CPK, glucose, cholesterol, creatinine, and serum iron. The basic autoanalyzer system is an interconnected series of modules, each designed to perform essential functions of the analytical chemist in an automatic and continuous progression. 1. The sampler holds the solutions to be analyzed and presents them to the system one by one on a program basis. 2. The proportioning pump aspirates these samples, adds the necessary reagents in precisely metered quantities at the proper time and place in the system, and propels the sample and reagent mixtures through the remaining modules. The continuous dialyzer is used as a filtration, the protonization or dilution module, as required by this particular chemistry, being performed. 4. The heating bath adjusts the temperature of the flowing analysis stream to the optimum required for color development or other reaction. 5. The dual beam colorimeter with flow-through cuvette continuously reads the optical density of the sample stream. 6. The recorder continuously plots ratios of the signals from the colorimeter sample and reference photocells on a moving strip chart. Each sample is represented by a separate peak on the chart, the height of the peak being proportional to concentration of the substance being analyzed. The versatility and flexibility of the autoanalyzer systems are enhanced by the fact that different modules may be substituted for those mentioned, as may be required by a specific chemistry. For example, a continuous filter is sometimes used for precipitating reactions. A flame photometer or a fluorimeter may be indicated instead of a colorimeter. A digester module may be used to perform automated Kjeldahl nitrogen determinations. The concept of interconnecting multiple modules is responsible for the system's versatility. The principle of continuous flow dynamics on which the system is based has resulted in previously unattainable efficiency and accuracy. But for teaching purposes, one special feature of this instrumentation stands out. Unlike black box instruments that may do a job but are difficult to explain, the autoanalyzer system is open to examination and demonstration. Movement of the various sample and reagent streams, mixing phenomena, color changes, precipitate information, etc., are visible, predictable, and explainable. The system, with its moving liquid streams, captures the interest and enthusiasm of students because they can see what is happening and because they can easily learn how to make modifications to change methods according to their own requirements. The SMA 1260 produces serum chemistry graphs at the rate of 60 per hour, or an effective analytical rate of 54 per hour plus 6 standards. This amounts to a maximum of 432 12-test profiles, or 5,184 chemical tests in an 8-hour working day. The time from aspiration of a given sample to finished chart is only 8½ minutes, less time than it takes to complete any one of these tests by other methods. The result of the 12 tests for each sample are reported in concentration units on the recorder's serum chemistry graph and on the digital report form. The Technicon ID number for each sample is automatically printed on each of these forms. Since the normal ranges for each parameter are pre-printed on both forms, the physician does not have to remember the normal values. With the time interval between drawing blood and recording results drastically decreased, the usefulness of the analytical data is greatly increased. With no sorting, calculation, transcription, or collation required, the results are immediately ready for transmittal to the requesting physician for evaluation and placement in the patient's file. There is no need to hold up the report till the end of the day while other slower tests are being completed. Diagnosis can often be made before a laboratory using other procedures delivers its report. In continuous flow analysis, the color intensity of the air-segmented analytical stream is continuously measured in a colorimeter and at the same time continuously recorded on a strip chart record. One has, at all times, written continuous recordings of system function, in contrast to a mere number on a piece of paper. On the SMA 1260, in addition to the primary recording on the serum chemistry graph, the SCG, the complete analytical curve for each of the 12 to 16 channels is visually displayed on a function monitor. Thus, one has at all times a visual display of machine function. 4 blank correction channels are possible with the SMA 1260 system, for use with those test procedures which require them. Tests that do not require blank channels use dialysis to eliminate the necessity for a separate blank channel. The blank values for total protein, albumin, LDH, SGPT, and total bilirubin are automatically subtracted from the assay values, and only the corrected value is charted. Lipemic or icteric sera no longer pose a problem for accurate biochemical analysis. Automated blank correction combined with dialysis make Technikon SMA systems the only instruments capable of fully eliminating the effects of nonspecific chromogens on test results. Actual measurements are made only after the analytical curve reaches its steady-state plateau, which may be defined as an equilibrium condition in the system at which there are no changes in concentration with time. At this steady-state plateau, all effects of possible sample interaction have been eliminated, and the recorded signal gives a true reflection of the concentration of the constituent being measured for. Herein lies the importance of segmenting each of the sample and reagent streams with air bubbles. In effect, the air bubbles act as barriers to divide each sample and reagent stream into a large number of discrete liquid segments. Equally important, the air bubbles continually scrub the walls of the tubing. This sequential wiping of the walls diminishes the possibility of contamination in succeeding segments of the same sample. Thus, should there be an interaction between two samples, it can easily be seen that the effects of this interaction will occur only in the first few segments of the second sample. In the middle segments, the air bubbles immediately preceding will have effectively cleansed the system and prevented further interaction. It is these middle and final segments, free from interaction, which are recorded as the steady-state plateau and appear as flat lines on the SCG. This assurance of freedom from contamination can only be accomplished by continuous flow analytical techniques, which form the basis of all auto-analyzer systems. By contrast, in batch systems, one never knows whether a result is valid, that is free from contamination, or imperfectly processed. All one sees is a number. About 2.0 milliliters of untreated serum is all that is required for the accurate and simultaneous performance of all 12 biochemical tests. The Technikon ID system for positive sample identification consists of a sampler 4 with optics, a buffer for storing the coded information, and a printing device for transferring the sample number to the serum chemistry graph and to the data converter. The system uses adhesive labels which are affixed to 1. The sample tube immediately after the blood is drawn, 2. To the requisition slip, and 3. To a special sample cup that is inserted into the sampler. This last label is somewhat larger in size than the others because it utilizes a specially designed barcode that can be read optically. With Technikon ID, there is no need to verify the results on the graph corresponding to the order of the specimens on the sampler. Nor is there any need to go through the time-consuming process of loading the sampler according to a loading list. Stat tests can be inserted into any of the 40 sample cup positions at any time without interruption of normal laboratory procedures. The 4 Technikon proportioning pumps, which include the new air bar design feature, are as characteristic of the autoanalyzer as the air bubbles separating samples. Each pump's chain-driven rollers depress up to 26 resilient plastic tubes. As the rollers move across the tubes, they propel the various fluids ahead of them into the system in the exact proportions required by the test. The volume of each fluid aspirated into the system by this process is determined by the inside diameter of its particular pump tube. The flow rate of each stream, whether liquid or gas, can be varied in 19 standard steps from 0.015 milliliters per minute to 3.9 milliliters per minute. However, the SMA 1260 uses only the smaller sizes, thereby effecting low reagent consumption. Completely positive in action with no slippage, The proportioning pump maintains precise ratios of flow continuously. It may be operated 24 hours a day for months on end. Two rollers are always in contact with the tubes to eliminate any possibility of backflow. There are no valves to clog or stake, no crevices to retain unwanted materials. The pump contacts only the tubes carrying the liquid, never the liquid itself. A built-in leak detector sounds an alarm and automatically stops the pump if a tube contacted by the pump rollers should develop a leak. This is the SMA 1260. A shows the sampler 4 with Technicon ID. B, the proportioning pumps. C, the analytical cartridge. D, the colorimeter. E, the programmer. F, recorder. G, the printer. H, the function monitor. I, the automatic calibration module. J, the data converter. And K, the teletype. For those familiar with AutoAnalyzer and SMA 1260 systems, the analytical cartridge perhaps represents the most revolutionary innovation on the SMA 1260. Each test has its own removable analytical cartridge, which is, in effect, a miniaturization and integration into optimum form of all equipment necessary to perform such analytical techniques as mixing, dialysis, heating, time delay, and phasing. The analytical cartridge permits a simplification of technique resulting in increased flexibility and ease of operation. Any one of the 12 separate plug-in analytical cartridges can be removed and replaced by one designed to perform a different determination. In addition, a change in test also requires a new function board in the programmer, a change of recorder paper, and a colorimeter filter substitution, all of which may be performed in the laboratory. The miniature dialyzers and the analytical cartridges that require this technique are designed for easy accessibility. With the new pre-mount dialysis membranes, a change can be accomplished in less than a minute. The pre-mounts are individually wrapped and moistened at the factory. The technologist merely opens the envelope, puts the membrane in place, and tightens the screws. Bubble patterns are completely visible in the dialyzers at all times. Temperature control, where necessary, is achieved by passing the donor stream containing the sample through a jacketed mixing coil. This kind of dialysis, combined with the capability of automatic blank correction, make Technicon SMA systems the only instruments capable of fully eliminating the effects of nonspecific chromogens on test results. For those procedures requiring heating or incubating as a step in color development, the new analytical cartridge incorporates a small individual short path heating block through which the reaction stream passes. This element is thermostatically controlled and is not susceptible to changes in ambient temperature. With 12 tests to be recorded on each sample and a sampling rate of 60 samples per hour, it follows that 5 seconds are allowed to record each steady-state plateau. The reaction streams in the 12 channels and up to 4 blank channels must, therefore, be phased to arrive at the colorimeters in waves 5 seconds apart. For example, if the cholesterol stream arrives at X time, calcium must arrive at X plus 5 seconds, total protein at X plus 10 seconds, albumin at X plus 15 seconds, etc. In order to ensure proper sequencing for presentation of the results, a number of devices have been provided to make this adjustment an extremely simple operation. Time delay coils on the analytical cartridge accomplish sequencing of the up to 16 tests where time delay is required. They are easily accessible and can be completely changed if the need arises. The new colorimeters on the SMA 1260 system have an improved wavelength range of from 340 to 700 nanometers, providing sensitive and specific enzyme analysis of the NAD-NADH linked reactions, SGOT, SGPT, and LDH. To decrease lag time, the colorimeter flow cells are located as close as possible to their analytical cartridges. The 4 colorimeters, each consisting of 4 analytical channels and 1 reference channel, are positioned immediately above 4 of the analytical cartridges. The blank channels are identical to their sample channels and can be used interchangeably. Moreover, should one colorimeter become inoperative, the system can still be run for the remaining 75% of the tests. This is a flow system of individual chemistries. After the sample is aspirated, it is split 6 ways. In stream 1 is SGOT, stream 2 for alkaline phosphatase, stream 3 for uric acid, stream 4 for inorganic phosphate, stream 5 for cholesterol, and stream 6 for total protein, albumin, calcium, glucose, blood urea nitrogen, lactic acid dehydrogenase, and bilirubin. A few of the diagnosis possibilities from the results of the biochemical parameters are shown in this slide. Amylase, the alpha amylase, if it's increased, can indicate acute pancreatitis. Bilirubin present can indicate breakdown red cells or in jaundice. An increase in calcium, hyperparathyroidism, hypervitaminosis D, multiple myeloma, secondary carcinomatosis involving bone. A decrease in calcium, hypoparathyroidism, osteomalacia, and steatorrhea. A decrease in cholesterol can indicate hyperthyroidism, nephrotic syndrome, pancreatitis, or diabetes mellitus. An increase in creatine, myositis, various dystrophies, and myasthenia gravis. An increase in glucose, diabetes mellitus, hyperactive adrenals, sepsia, meningitis encephalitis, tumors. A decrease of glucose, insulin overdose, myxedema, hypopituitarism, Addison's disease. An increase in LDH, myocardial infarction, pulmonary embolism, or hepatic disease. An increase in lipase, acute pancreatitis. An increase in non-protein nitrogen, renal damage. Increase in alkaline phosphatase, osteoblastic activity, impairment of liver function, or obstruction of bile flow. A decrease is only been found in hereditary conditions called hypophosphatasia. A decrease in total protein indicates an abnormal condition present. A decrease in protein-bound iodine, creatinine, myxedema, hypothyroidism, or Hashimoto's thyroiditis. An increase in protein-bound iodine, hyperthyroidism, or acute thyroiditis. An increase in transaminase, myocardial infarction, or liver disease. Blood urea nitrogen indicates diarrhea, a reduced volume of body fluids, diabetic coma, Addison's disease, or shock following burns, cardiac failure, nephrosis, or renal calculi. A low blood urea nitrogen is very rare in hepatic disease. A high uric acid could indicate gouty arthritis, renal failure, toxemia in pregnancy, leukemia, pneumonia, and polycythemia. A high inorganic phosphate can be due to renal insufficiency, intoxication by an overdosage of vitamin D, hypoparathyroidism, acromegaly, and metastatic malignancy to bone, a low in organic phosphate, hyperparathyroidism, vitamin D deficiencies, and renal tubule abnormalities. Routine biochemical profiling of all serum samples processed by the hospital laboratory has been shown to effect substantial changes in or reevaluations of original diagnosis. After instituting this regimen, one large metropolitan hospital has found that at least 3 in 10 of the patients being admitted are harboring an additional disease or organ malfunction at such early stages of development that symptoms are not yet evident. As an example, one patient admitted for elective surgery was found, on the basis of biochemical profiling, to have probably suffered a minor coronary. This condition was not sufficiently developed to cause changes to be noted in the electrocardiogram. In this case, surgery was postponed and the patient referred to a cardiologist and a confirming diagnosis was made. Another investigator has reported that the unrequested information in the profile admission chemistry was beneficial to almost 1 patient in every 10 entering the Duke University Medical Center, and for 1 patient in every 20 entering the VA hospital in Durham, North Carolina. In addition, at the latter institution, it was deemed of particular interest by the physicians that in 2% of the cases, the unexpected findings resulted in a substantially earlier institution of important therapy. Another leading university medical center found that in excess of 10% of all patients routinely profiled turned up unexpected values. The director of pathology at a large southwestern hospital recently stated, "In my 8 years' experience in a 300-bed hospital, not 1 case of parathyroid adenoma had been diagnosed. With the introduction of the SMA-12 and routine chemical profiling, 3 cases were diagnosed in the first 3 months. Moreover, information is available to indicate that the patterns described above are representative of what is happening in hundreds of hospitals here and abroad since the introduction of sequential multiple analysis." Recently, a special Senate subcommittee on detection and prevention of chronic disease utilizing multiphasic health screening techniques stated that the evidence is conclusive that multiphasic health screening can be practical and important tool for the medical profession in the early discovery and ultimate treatment of chronic disease. Until the introduction in 1965 of sequential multiple analysis in the form of SMA-12, comprehensive biochemical profiling has been prohibited because of time, labor, and cost considerations. The experience gained from extensive use of this revolutionary instrumentation have shown that these obstacles are no longer a factor. 60 samples per hour, 1 technologist, cost per 12 parameter test less than that of 2 parameters performed individually.